Welcome to the Institute of Natural Health and Education School of Massage Therapy. Today we're going to be talking about or covering specialized clinical massage for sciatic pain. During this presentation, we're going to have an overview of the anatomical structures of the lumbar spine, most common symptoms associated to musculoskeletal imbalances of the hip and lumbar region, methods that we're going to be using for specialized assessment procedures, an integrated way or approach to treatment, and clinical application of massage techniques. That all of those with the goal to restore proper balance, decrease muscular discomfort, and enhance the patient's range of motion. During the next few screens, we're going to be covering a few things such as the anatomical structure of it. So in the case of the lumbar spine, which consists of 5 vertebrae labeled L1 or lumbar 1 through L5, we're going to be analyzing them in a moment. The lumbar spine typically has a slight inward curvature, also called as lordosis, which should be normal. Too much will be abnormal lordosis, or you can have more of a flat lower back, will be also abnormal on a lordotic curvature. The lower back region, which contains large muscles, helps to support the back and allow the movement of the trunk of the body, also the hip. These muscles can also go into a spasm or become strained, which is a common cause of lower back discomfort. The two lowest segments in the lumbar spine, which is L5 to S1 and L4 to L5, carries the most weight on the lumbar and hip region that have the most movement, making that area between L5, S1, L4, L5 to be the most common areas prone to injuries. On the lumbar spine here, you're going to look into what we call the vertebral spaces, which are the spinal discs, is part of that space, which helps to cushion the joints of the spine and provides support during movement of the hip and movement of the lumbar spine. Those discs on the lumbar spine are most likely to be herniated or degenerate, which can start causing some compression on the nerve that can be associated to lower back pain, which sometimes can or not, but could radiate the pain all the way down to the leg and going down on the feet. So this pain that radiates down to the lower extremity has a name in medical terminology. It's called a radiculopathy. Radiculopathy is a pain that radiates all the way down on the leg. So this is a X-ray of a lumbar spine position. As you can see here on the left-hand side, you can see the spinous processes of the vertebral column of the lumbar spine here. You can see the nerves exiting from the foramina here, the area where the nerves exits. You can see the discs here. In this case here is an X-ray which doesn't show the tissue of discs, only show the osseous tissue, not a soft tissue of a disc. This is why you don't see that in there. Not that this person doesn't have a disc, but X-rays don't show discs, only shows the bones. So in order to see the disc and the bones, you have to do an MRI of that lumbar spine. So, but as you can see here, you have a pretty nice disc spaces there. And of course, as you get down here, it requires a little bit more of a support, so the disc's a little broader there. So this is not too bad of a lumbar curvature in that case. The basics involved with anything involved with the lumbar spine, which in this case, what you see here now, and contrary to the previous one with an X-ray, you see a MRI of the normal spine. As you can see it over here, you get the MRI of the discs. As you can see the L4, L5 here. And I wanted to point it out in this area here is a little bit of a compression that is putting on the spinal cord right there. This is the spinous process on the back here. You got the skin over here, and you got a little bit of a compression right there, right on the area of the disc that is compressing against the spinal cord. So this is the spinous process, which will be over here, and you can see the disc spaces there. All right, now as we continue here with the muscles associated to some of the discomfort that can occur due to some postural deviation of the lumbar spine, as you can look at over here, we have this muscle here. This is called the iliopsoas muscle, okay, that goes from the lumbar spine here on the side of the lumbar spine all the way down to the last trochanter of the femur. And you can see that this is the iliacus and this is the psoas major and minor. So those two muscles together is then called the iliopsoas, which is a powerful hip flexor. So you can have unilateral tension on this, or you can have bilateral tension on both sides of this one here. So when you are on your feet, providing some weight bearing on your feet, and this muscle is tense, it takes your spine here forward. Otherwise, for you to elevate your leg or put your knee towards your belly, that's called hip flexion. And that will be engaged in this muscle with a little bit of help of one of the quadricep muscles here, which is the rectus femoris. So as you can see here, this is on the posterior region of the hip area. You have the piriformis, and the piriformis that comes from originating itself from the anterior region of the sacrum. It goes to the top of the greater trochanter of the femur there, which is associated to several movements of the hip, such as lateral movement or external rotation in that case, and some of the lateral movement of the hip there. But as you can see here, underneath of the piriformis, you have the sciatic nerve, which is composed of two different nerves. And this muscle, if it's too tight, puts pressure over here that can cause pain down on the posterior region of the leg. It can be all the way to the feet. And the two nerves that compose the sciatic nerves, we split themselves behind the knee on the popliteal region. One segment going to the front of the lower leg, another segment going to the posterior leg region, lower leg region. So this, I generally call this as a non-true sciatic compression if it is this sciatic nerve compressed by the piriformis. If the sciatic nerve is being compressed here by a bulging disc or herniation or stenosis, I generally refer that as being true sciatic compression. So the iliopsoas is involved with the flexion and lateral rotation of the thigh or the leg. The quadratus lumborum, it's a muscle on the side which elevates your hip or takes your spine to a lateral flexion. The piriformis, as I described, runs from the lumbar region diagonally to the lower spine to the upper surface of the femur, and then the sciatic nerves run underneath of that muscle. As we continue with the muscles, we talked about the piriformis a little bit more, which sometimes refer that as piriformis syndrome, that occurs when the piriformis is too tense and irritates and compresses the sciatic nerve. That's called, to me, the way I refer that is a non-true sciatic compression, which is done by this muscle. Now, in this case, massage therapy treatments is very effective because you go to this, the compression done by the muscle and release the tension on the piriformis, taking that pressure away from the sciatic nerve. On the true compression, on the other hand, the sciatic nerve can be compressed either by a disc problem or a bone spur or a stenosis. In that case, the treatment would be slightly different, which would be to improve the disc space or the joint space on the lumbar region and take that pressure away from the disc. As a result, the overuse or injuries or other strains, the piriformis muscles can tighten itself, can be a little swollen, or can go into a spasm. So a lot of times it's not just because of an injury, but it can be because of a faulty posture. Here in this case, you can easily see the symptoms of piriformis syndromes or non-true sciatic compression done by the tension on the muscle here on the piriformis over this sciatic nerve. And this the MRI here, as you can see, is a sciatic compression or a true sciatic compression done by a herniation of a disc. And then as you can see it over here, this is L5. Okay, lumbar 5. As you can see, the herniation is very, very dramatic over here. It's pushing quite a bit on that area. So as the nerve trying to exit this way, it will be compressed by the herniated disc here. You can see a slight herniation over here too, but this is the one that has the most form of a herniation. A lot of times people will go for what they call laminectomy, which is shaving off a little bit the disc, or if it is extremely herniated, a lot of times for surgical procedure is necessary where they will remove the disc and they put a spacer over here and then do a fusion. As we continue with the presentation, we can go over and look at a little bit of the spinal stenosis that is done by bone spurs that get developed on the foramina where the nerve comes out from. It's not a herniated disc, but it's being compressed by accumulation of bones around it, enclosing the foramina of the spinal canal. And that it compresses the nerve here, creating similar pain as a bulging disc in the way. So the spinal disc act as a shock absorber for that in that case. So as the person develops some form of a herniated disc, they can actually start getting a central canal stenosis or narrowing of the central canal. Also, symptoms of a lumbar stenosis can develop slowly over time. A lot of times they say that people over the age of 50 can start developing that because of degeneration of the disc. Lumbar stenosis could include, not always, but it could have some of the symptoms or all of those symptoms, which is called the spinal stenosis with leg pain upon walking or claudication, tingling feeling going down on the leg, weakness, numbness radiating from the lower back all the way down to the buttocks and down to the legs. All right, next is an assessment. The most common cause of a lower back pain in this case is either muscle strain or other muscular problems. This can be due to heavy lifting, bending, rapid movement, repetitive things, and can develop over the days or weeks, depending on how severe the situation is. Any irritation of the nerve root that exit the spine or joint problems, the discs themselves can also create an impact when it comes to the discomfort. Here, as you can see, some of the assessment of a normal posture position of the spine, and here you see the individual with a kyphotic curvature and more lordotic curvature, which is abnormal postural deviation that could influence how the lumbar discs or stenosis in a feature or herniation or even a compression of the non-true sciatic compression done by the piriformis. As we continue with the assessment, we need to look for any form of a kyphosis due to postural problems. Also, we can provide some kind of a massage therapy stretch to relax the primary tensors. We can look into lordotic curvature and address the muscles that are taking the lumbar spine into this abnormal postural position, and fix that by massaging and stretching the primaries and then massage the secondaries. Here, as you can see, another postural imbalance. You see the normal postural position on the right hand side, an abnormal postural position that you can actually have the person standing, and you can just analyze that, which then, as you can see it over here, you got an elevation of the right hip there, you got a depression of the right shoulder, and then creating this lateral curvature of the spine. So all of those things will have to be taken into consideration as you're doing your physical assessment. Now, if the individual had a surgery or a fusion, or come in after having the fusion, you have to look for other possibilities. And in general, there's so many different procedures for fusion. In this case here, I'm covering just this kind of a fusion, which they remove the disc over here, put a spacer here on the place what used to be the disc, and then they put those brackets and put the screws over here. So you got to be really careful, because when the person is laying on the table, don't put too much pressure on the muscles around this area, which is the erectus spinae muscle. You don't want to push the muscle against the screws or against this area, end up bruising the muscles. Also, be careful with the stretch, pulling the ankles down, etc., because this is not actually very movable anymore after they have the fusion done. So the first step before you can conduct any form of a treatment is to do the assessment. And the assessment comes from not only asking questions, but do a physical assessment, making sure you analyze postural deviation, primaries and secondary tensors. Afterwards, you're going to be looking into providing the proper treatment according to what you found to be the muscles that need to be massaged and stretched, and muscles that only need to be massaged. Here at the end, it's suggested having all individuals working with this to do a little practice by looking into those 4 case studies, and for each of those case studies, applying the principles of what kind of assessment I'm going to perform for each of those, what kind of muscles are primary, secondaries, what kind of treatment I'm going to have to do, what is the indication or contraindication, can this person be stretched for the lumbar or not, should I be careful with not pushing too hard against an implant or any other metal component that was put in on the person's lumbar area. So you have the 36-year-old female with external rotation of the left hip. We have another case here, 63-year-old client seeking massage for lower back pain. They're radiating down to the right posterior upper leg region. And then this person has previously been diagnosed with lumbar herniation between L4 and L5. The third one is a client with post-surgical fusion, L4, L5, and suffering now from pain on the left lumbar region. And the last one is a 48-year-old client diagnosed with a spinal stenosis on the right, on the sides there between L3, L4, and L5. You got to keep in mind that a spinal stenosis, you cannot reverse this with massage. A lot of times they go in and have a surgical procedure with they scrape off the extra bone that grew around the foramina. But it helps to reduce some of the pain. Okay, this will conclude our presentation related to lower back issues here. Thank you for participating.